Okay, yeah, recording, sorry. So number 6, for the taste, anterior 2/3, facial, posterior 1/3, glossopharyngeal, number 9. So in this case, if you know that already, right, you figure it out right away. So it's actually B. Number 6 is B. Yeah, facial for the anterior 2/3 and posterior 1/3 is number 9. So answer is B. Okay. Yeah. So this you have to be very careful. And number 7 is kind of a little case study. Yeah, and talking about a person had a problem with fertility. Yeah, infertility, and also have a history of the pelvic inflammatory disease (PID). And then there's actually a microbial infection involved. So what two infections are typically involved? Yeah, so one actually is what? Chlamydia. Another one is gonorrhea. Actually, both of those, the co-infection rate is 50%. So 50% of the cases have both. So that's why in the terms of treatment, both organ bacteria must be covered by antibiotics. Okay, so number 7 is D. Okay, number 8. Yeah, that's a basic question about blood type. So this person, red blood cell surface has no antigen at all. A, B, RH, nothing. So then what kind of blood type is this? That's obvious, right? So ABO, nothing, that's O. RH, you don't have it, that's negative. So that's why the blood type is O negative. Yeah, so number 8 is B, O negative. Okay, so that's how you define, is by what type of antigens do you find, okay? So that's B. Number 9, yeah, sensory dysphagia or difficulty in understanding speech. Understanding speech is what we call Wernicke's area. Wernicke is where? Is on the temporal lobe, the temporal. Yeah, so thinking about this, it's a sensory, understand. Understand, you have to hear it, right? Kind of related to the hearing. So it's D. Number 9 is D. So it's more hearing. That's for sensory. Now, actually, another question later you're going to see. How about a motor? If a person can understand, but just cannot talk. So that's a motor dysphagia. Motor dysphagia is in the frontal. The frontal lobe, you have Broca's area. Broca is for motor, for speech, actually. Yeah. So if you cannot speak, then that's frontal, okay? But this is what? Sensory. So it's D. So you have to be very clear, okay? So different regions on the brain. So number 9. Number 10, yeah, this is the physical assessment using a tuning fork. And then to test the what? The hearing conditions, right? And try to differentiate different types of hearing loss. And those tests are called what? Well, those we haven't reviewed yet. Those names, you have to know that. Renee and Weber's test. Renee and Weber. Yeah, so using the tuning fork. So number 10 is B. Yeah, is B, okay? Number 11, at what age measles, mumps, rubella, chickenpox, those all virus infection vaccines should be given? Yeah, actually, at least the baby has to be 12 months old. 12 months. Why? Because those vaccines will use a live viruses. Those are live. As the baby's immune system not ready yet before within the first year. So you have to wait at least 1 year old. Then the immune system can respond and then generating antibodies. So that's 12 months. Actually, 12 months is the youngest age you can consider. Yeah, Texas, I think, is 15 months. Yeah, and some other states, I heard also 18 months start to give MMR and the chickenpox, okay? Yeah, so this is because the live virus, you don't want to give it too early, okay? Yeah, so this is what, 12. Number 11 is B, okay, B. Number 13, yeah, is you wear a mask to prevent the transmission. This is just asking what disease is transmitted through the respiratory tract, right? That's why you wear a mask. And obviously, you know that is B, pertussis. Yeah, anybody know what's another name for pertussis? Pertussis is what? 100-day. Yeah, 100-day cough, which is also called whooping cough. Whooping cough. Yeah, so cough, respiratory, right? So you have to wear a mask. Yeah, so B, pertussis, whooping cough. Okay, we do have a vaccine that can prevent that. Okay. Number 13, yeah, 24-year football player now complaining newly developed pimples, acne, all of a sudden body, trunk, face. Yeah, what do you suspect? Why suddenly, 24 years old already, right? Yeah, very likely, Yeah, so you think about this is what? Probably is use of steroids. Steroids. Yeah, steroids is testosterone that could promote activities of the oil glands, just like a puberty. A boy reaches puberty, have a lots of what? Testosterone, right? That's why easy get pimples and also acne. So this steroids also strengthen the muscle. So that's why lots of athletes, especially professional athletes, they would use what? Steroids.
How about the
poor personal hygiene? You can, but it can be suddenly just have a lot of things come out. Is that right? You may have a once a little bit here, a little bit there, but that's not the direct cause. You know what I'm talking about? It says newly developed pimples on the face, on the body, like a lot. You suspect steroids. So this is like by chance. Yeah, if a person has a poor hygiene, maybe get a couple on the face. Yeah, it's possible. Or maybe got a one on the back. Is that right? But it can't be just newly developed a lot, Yeah. This is generally you try to balance out. So A for 13 is right. Okay. You know what? This question was, I was told a few years ago, was on a national board exam, equivalent concept. Yeah, they were asking that. To see if you understand. Steroids may have this side effect. Okay. Number 14, hepatitis virus, which one? Must be co-infected with B, because this virus is a defective virus. On its own, it cannot infect the body, which is actually defective D, right? It's easy to understand. So hepatitis D must be co-infected with B. But why have the co-infect? Because if you're defective, you have to use the perfect virus machinery to generate new viruses, so which is B. So BD is together. So 14 is C, okay? Hepatitis D. Or D, think about it's a defective virus. It cannot affect the body on its own, okay? 15, skin condition. Yeah, with the onycholysis, which is the nail destruction. Yeah, nail destruction. So what diseases? Skin disease. Sometimes they have a nail destruction. Yeah, it can be on case studies too, but this is a simple statement, which is actually what is B, psoriasis. Psoriasis. Yeah, psoriasis patient, sometimes the nail gets destroyed, and then you may think it's a fungus infection, right? And then until you examine it, test it, find out it's not a fungus. Yeah, it's because psoriasis. So psoriasis can cause that. Okay, it's autoimmune condition. B, number 15 is B. Number 16, microbial disease, caused by acid-fast bacteria. So this is actually tests your microbiology. Bacteria that is acid-fast, which is called mycobacteria. Mycobacteria only cause two diseases. One is tuberculosis, and the other one is what? Leprosy. Yeah, we'll review actually after this week. Next week, I think we're going to get started. Yeah, maybe on the microbiology, something later we'll have. So this is actually those two. But then you don't have a TB, but always those names, then what it would be? Actually, it is Hansen's disease. Now, what's Hansen's disease? Hansen's disease, another name is called leprosy. Leprosy, yeah, which actually happened before on the board exam. That's very tricky. Crohn's disease is inflammatory bowel disease, right? Crohn's disease is hyperaldosteronism. Hodgkin disease is a lymphoma. But Hansen's disease is a leprosy. Leprosy caused by a bacteria, which is a mycobacteria. Mycobacteria is what? Is stained by acid-fast dyes. Yeah, acid-fast, a particular staining reaction, okay? Yeah, so this is one. Also another one, tuberculosis too, also by acid-fast, okay? Number 17, nerve injury resulting in the wrist drop. We reviewed that before, right? Is what? Is a radial nerve. That's a radial nerve. You cannot extend the wrist. So radial nerve injury, right? Causing a wrist drop. So which is B. 17 is B, okay? 18, sexually transmitted infection caused by a virus. Syphilis is a bacteria. Gonorrhea, bacteria. Chlamydia is also bacteria, but genital herpes virus. Yeah, herpes is virus. That's very straightforward. So D is virus, number 18. Number 19, this person, 32 years old, you see, increased appetite, weight loss, lots of sweating, lots of energy, heartbeat fast, cannot sleep, and then you check the neck a little bit swollen, hands having some tremor, and then test T3, T4 power is high. Most likely is the thyroid, right? Overactive thyroid. But then that's what. But if just test T3, T4 is not enough. At the same time, you need to also test another thing to confirm your diagnosis. So which one need to be tested? Actually, the answer is what? Is TSH, thyroid stimulating hormone. Now, this is just test your negative feedback concept. If T3, T4 is high, negative feedback, pituitary gland, TSH level would be what? Low. Would be low, right? So this is help you confirm this patient is having a hyperthyroidism. So thyroid is functioning too high, okay? And that's a typical case presentation with a hyperthyroidism, okay? So D is the answer. 20, ADH, that's a hormone. It's produced by what? Yeah, be careful. Produced means secreted by hypothalamus. But it is released by posterior pituitary. ADH producing hypothalamus sent to the posterior pituitary for temporary storage. And then if the body needs it, it helps release it. Yeah, so produced by hypothalamus, okay? So B, 20 is B. But if it's a release, that's a posterior pituitary. Okay. And then 21, inner ear or inner ear structure, right? For hearing, for balance, or they particularly ask for dynamic balance. Dynamic means if you do rotation activity, it can keep you balanced. And what structure is that? It's deep semicircular canal. So that's dynamic. Now, if it's a linear movement, no rotation, that's a vestibule. Vestibule is for balance, linear balance, okay? And the cochlea is for hearing. Auditory tube is the one that connected with the throat. Yeah, middle ear to throat is not even inner ear, okay? So that's why all those anatomical structures, you have to make sure you understand. And also what exactly each structure, the functions as well, okay? So this one is D, 21. 22, smooth muscle found everywhere, right? Except the one. Well, this is actually straightforward, except the heart. Heart has a cardiac muscle, right? Or bones, you have skeletal muscle. So heart does not have smooth muscle, but blood vessels do have smooth muscle. Then people say, at least partially is right. No, remember, we tell you the test question. For choice to be correct, it has to be 100% correct. For choice to be wrong, even partially wrong is wrong. You got it? Correct has to be 100%. So that's why this is not right. B, heart is cardiac muscle, even though blood vessels have smooth muscle, but at least half of it is wrong, right? Yeah, so that's why. So except this one. Everything else, stomach, intestine, uterus, fallopian tubes, ureter, bladder, they all have smooth muscle, okay? So that's how you judge this question number 22. 23, muscles responsible for flexion, extension, and the rotation of the head. Head going down, going up, and then turning around, and then, yeah. So what muscles? Well, we know that head going down is SCM, sternocleidomastoid. Head going back up is what? It's trapezius. And then turning the head is also SCM, but on one side, right? So those two muscles, sternocleidomastoid and trapezius, they are controlled by the same nerve. Which nerve is that? Is actually cranial nerve number 11, which is called accessory nerve, C. Number 23 is C, accessory nerve. Yeah, so this is also a basic anatomy physiology, question, okay? The concept. C is correct. And then 24. 24 is what? Middle-aged man. Yeah, red eyes, painful urination, inflamed joints, yeah, limited movement. It sounds like it's not related. One is eye problem. Another one is the urinary problem, urinary system, maybe UTI. And then the other one is about joint, arthralgia, arthritis. But remember, we told you a sentence, if you can remember. If a person presents with this, can see, cannot see, can pee, pass the urine, can pee, can climb a tree, that's a joint, right? Yeah, so what's the conditions called? Those three, cannot see, cannot pee, cannot climb a tree. That's called Reiter syndrome. Reiter's syndrome. It's an autoimmune condition affecting the eyes, affecting the urethra, affecting the joint. So different organs. So you have to know that. So this is called Reiter's syndrome. Okay. So 24 is C. 25. Yes, we talk about symptoms related to overdose of anticoagulant warfarin. May reverse by what? So if a person use warfarin too much, anticoagulant, and have bleeding condition, right? Overdose causes bleeding. How do you reverse it? Well, reverse it, you have to know what kind of a drug is this warfarin anticoagulant. And warfarin is anti-vitamin K. Vitamin K is required for the liver to produce clotting factors. But if you block vitamin K and then you prevent a clotting, but you have a risk of bleeding. But now there's a bleeding, you want to reverse it, well, just give the injection of what? Vitamin K. Vitamin K. Okay, so this is, you understand that, the concept, okay? So it can be reversed by vitamin K, 25, okay? D. 26, which of the following gene is not X chromosome linked? Remember, we have some chromosomes that are actually linked with X chromosome. So that's why more likely the boys will get disease than the girls. Why? Because girls have to get both X, one from mother, one from father, right? But otherwise, if the mother is a carrier, easier just give to a boy because get a Y chromosome from the father, right? So that's more like boys. So what is he? Hemophilia, color blindness, right? And those are all what? X chromosome link. And also you have a 45XO Turner syndrome and a 47XXY as a Klinefelter. One is a missing X, the other one is extra X. Yeah, those are all X chromosome related. So this is what? Not X chromosome. That's a Down syndrome. Down syndrome is a regular chromosome. It's a non-sex chromosome. Chromosome number is what? Is 23, right? Trisomy 23. So 3 copies instead of 2 copies. That causes Down syndrome. So this is not. Down syndrome has nothing to do with X chromosome. In other words, boys, girls affected what? Same. But original cause is more likely is the mother. Why? Because when the mother maternal age over 35, and in the risk X gets old, right? And easy get mutated. So the incidence of Down syndrome goes higher. Okay. So that's B, 26. 27, neurodegenerative disease. In the basal nuclei was a dopamine deficient. Those are all features, 3 features, right? What disease is that? Is a Parkinson's disease. Parkinson. We all know that, right? Lack of dopamine in the basal nuclei and a neurodegenerative, B. Okay? 27 is B. 28. Yeah, that's the test. Apley's test. Yeah, to test the what? Meniscus. And there's another test also do the meniscus, which is what? It's called McMurray test. McMurray. So Apley's compression, McMurray, and we'll talk about those names. Yeah, after probably next week too, so we're gonna move on. So those 2 tests are particularly for the knee joint, the meniscus, extra pad of cartilage. Yeah, so you test that. So that's B. 29. Yeah, green, golden, smoky corneal rings, the cornea. You see the rings, this color. And then this is actually what? When you detect it, is for Wilson disease. But what's wrong with it? Well, what kind of minerals metabolism has a problem? It's actually thinking about the color. Green, golden, like a bronze color. That's what? Copper. Accumulation of copper. Something wrong with the copper metabolism. And that causes the deposit of those things, okay? So that's a genetic, congenital disease, okay? So 29 is also B. 30. Yeah, we're kind of going fast. You know why? Because it's 100 questions, is right? Quickly. And then if a particular question, you got to answer, but you still kind of cannot figure it out, you have to search, get some more information or review your previous notes, all the courses. Yeah, try to understand. Each question tests you what. 30 is about meningitis. Meningitis, you do have some signs. It will review later too, right? Here, we have Koenigs, Bruzinski, Babinski, but not Chvostek. Chvostek is what? Is the low blood calcium. low calcium. Low calcium. And then basically what you do is when you tap on the face, it gets hit the facial nerve, it can cause what? The muscle spasm trigger, Yeah, because you don't have enough calcium. So muscle is a little irritated, yeah. So that's what can cause facial spasm, okay? So B. 30 is also B. 31, well, that's actually we'll review later too. When you file insurance, insurance for acupuncture, the code, CPT code, you have only 2 sets of code. Actually, it's very easy. If you now just briefly mention to you, if it's, first 3 numbers are the same, 968. The last 2 digits are different, 1011. 1011 is about when you do acupuncture. Initial 15 minutes, you file 10. The next 15 minutes, you file 11. You file 2 codes because acupuncture treatment at least 30 minutes, is right? Yeah. But then when do you do this? Is you use acupuncture without electrostimulation, no electrical stimulation. But if you use an electrostimulator, then you file the next 2, 13 and 14. Okay? Yeah, so first 15 minutes was electrostimulation. Second 15 minutes, what you use electrostimulation, that's 14. Okay? I think on purpose, they don't even have a 12. Just to avoid the fraud, so people file 12. Where's the 12? No 12. So 10, 11 appear, 13, 14 appear. So basically the difference just the what? Electron. So this one question. 1 or more needles are used with electrostimulation for initial 15 minutes of the patient one-on-one, contact with the patient. So which one you would put? C, right? C. If they have additional 15 minutes, and then you add a D also, right? Yeah. So we'll review that too. Tums. Tums is antacids, chewable, right? Sometimes you have acid reflux. But the thing is, they ask you, what is the chemical component of Tums? Tums is A, calcium carbonate. That's why the reason some people taking this as the calcium supplement, okay? Calcium supplement. So this is A. And then 33, 50-year-old present excruciating pain, swelling, in the big toe. Well, this is too easy, right? A lot of people think, this is a gout, most likely uric acid. And then how do you see medication could reduce the frequency of attack, which means for prevention. Prevention is what? Is you have a drug that reduces the uric acid production, which should be what? Allopurinol. But you know what? This is the old question. You would never expect this question anymore. You know why? They promise on the national board exam, there's no drug names, only category. So if it's a category name to prevent the uric acid formation, right? Those are the drugs that can actually reduce the chance of the gout attack. So actually this question is a C, okay? 34, the patient has appendicitis. Tender spot. Well, appendicitis is where, right? Right lower quadrant. 34 is C. Right lower quadrant. So we know that, right? It's called McBurney spot. 35, hypersensitivity. Poison ivy. So poison ivy is not a quick reaction. First, sensitize. First time. Second time, exposure and a reaction. So this is actually a delay time. Contact dermatitis, right? It's a through contact. So it's a delay time, 4. Okay, so type 4, D. D is the answer, okay? D. And 36, Trendelenburg test. Trendelenburg actually have 2 tests. One is to test venous valves. Another one is to test the muscles. This is actually testing the muscle. You just have to know what muscle they're testing. They're testing the gluteus medius and the gluteus minimus, which is for abduction of the thigh. So the answer is C, hip abduction. Hip abduction. We'll talk about this. How do you test that? A person standing on one leg to see if they can keep the stability. C, 36 is C. 37, injury to which nerve? Resulting biceps muscle. Loss of function. Well, biceps is control the musculocutaneous nerve, right? So that's a straightforward. 37 is D. 38, what structure of the brain? So the thermostat, that's also easy. Hypothalamus, right? Hypothalamus, temperature control center, D. 39, isopropyl alcohol. Yeah, the what? For swabbing, right? Yeah, rubbing alcohol. This is what concentration you have to know. Typically is 70%. 70%. Yeah, rubbing alcohol. Okay, 70%. B. 40, not correct about CNT. So CNT, well, you're gonna actually have a review. Not correct is what? Is B. Wipe the guide tubes with alcohol between different patients. No, each patient have to use their own guiding tubes. You can use this point, the other point, that's fine, but not within among different patients. That's going to transmit some problems because the guide tube inside may touch the needle, right? If you insert a needle to a patient and then you use it for another patient, it'll cause contamination. So 40 is B. 40 is B. 41, post-streptococcal, we reviewed that, right? It's glomerulonephritis, rheumatoid arthritis, the rheumatic fever, and scarlet fever, but not pharyngitis because it's post. Originally, it's streptococcal pharyngitis. That's not post. So A, first 41 is A. So that was the original infection. Here we talk about post-strepto, right? Coccal infection, the complications amount. So that's A. So 41 is A. 42, viruses. Yeah, it's a blood-borne pathogen with the needle sticks. We're mainly worried about just two of those, HIV and hepatitis B. Yeah, we know that, right? Which is A. 42 is A. 43, yeah, a patient is consulting primary physician about a recent tiredness. Yeah, now thinking about this, what condition is probably a patient present with tiredness? Tired. Yeah, a lot of disease, right? Cancer, yes. Anemia, yes. Hypertension, no. Hypertension patient will not feel tired. Actually, what? Lots of energy, right? Because blood pressure is very high. But diabetes, yes, because your body cannot use the sugar to make ATP. So in this case, least likely is high blood pressure. C. Okay, C. So you have to kind of judge it, balance it. 43 C. 44. 44 is 9-year-old hospitalized. You see, 9 months old, not 9 years, 9 months, right? Nausea, vomiting, high fever, weakness of the lower limb. Wow, that reminds you of something. And then when you do the spinal tap, it's fine. But we do find out the muscle is getting very weak. And then you do isolate a virus from the patient's throat. Yeah, so this is actually what? A poliomyelitis, poliovirus. But these days you don't see a lot. Why? Because of vaccine prevents this polio. Okay, so it's A. Yeah, eventually causes what polio causes the paralysis. Okay, so limpiness. A. 44. 45. Most abundant antibody in the human body is IgG. IgG. And IgG can even cross the placenta. So mother can send antibody to the babies, through placenta. IgG. That's the only antibody that can cross the placenta. Okay, so C. 45. 46. The device measure eyeball pressure. You know that this is called what? Tonometer. Tone. You measure the eyeball tone. If the pressure, if it's a high or not, right? And they try for diagnosis of a glaucoma. So this is A, tonometer, okay? Spirometer, B, is to measure the respiratory volume. Goniometer is to measure the angle of the joint. Sphygmomanometer is the blood pressure cuff. So those names, terminology, you have to be familiar with, okay? So 46 is A. 47, hormone from anterior pituitary. Prolactin, yes. Growth hormone, thyroid stimulating hormone, yeah. Oxytocin is not. Oxytocin produced in hypothalamus, just like ADH, but going to posterior pituitary for release. Okay, for release. So B, 47. 48, thickest cardiac wall. You can think about this as well. Is the left ventricle. That's going to pump the blood, right, to all over the body. So that's a C. 49, low progesterone level, middle to late menstrual cycle. That means after ovulation. If you don't have enough the progesterone from corpus luteum, right? Now that could be a problem of what? Why you don't have a low progesterone? Most likely is the patient It's not releasing the egg. If you don't release the egg, you're not going to have corpus luteum, right? And you're not going to have what? Progesterone release. So egg, only when the egg is released, then the remaining follicle becomes corpus luteum. The corpus luteum cells secrete progesterone. So usually when a person has a low progesterone, hard to get pregnant, right? What's the reason? Well, because you're not having what? Ovulation. So this is sometimes can help you diagnose low progesterone. Yeah. It's 8. 49 is 8. And ovulation. And ovulation means what? If there's no ovulation. Okay. Okay, appendix. Appendix is coming from which one? It's from cecum. Cecum. Yeah, the first part of large intestine. Okay, so that's an anatomical question, easy. 51. Yeah, see, actually, first 50 questions used to be one test, Form A, and then the second test, B, starting from 51 all the way to the end. So that's why the question, some of those questions kind of are similar, but a different aspect, so we'll see. For example, 51, according to HIPAA, remember the first question we have OSHA, right? So HIPAA. HIPAA says that if a patient requests a medical record, practitioner should release it. How soon should release it? If the patient requests it, 30 days. 30 days. Okay? Yeah, within 30 days. You can charge the patient, no problem, but within 30 days, if the patient, I need to have a copy of my record, you have to give to them. Okay? 30 days. B. And 52. Yeah, this is talking about the fatty diarrhea. Your body lose fat. That's going to affect the fat-soluble vitamin absorption, which is what? Vitamin D. Vitamin D is a fat-soluble. ACE is, those vitamins are water-soluble, okay? So except affect what? Affect what we talk about 52. No, 52 is ACDE. ACADE, those are fat-soluble. C is a water-soluble. So in this case, you lose fat, ADE will be affected, but C is not going to be affected. So in this case, the choice is what? Is C. All right? Except C. You got it? Yeah, the vitamins, fat-soluble, water-soluble. BC are water-soluble, okay? 53. Acupuncture needles, other device, penetrate the body, must be what? Must be sterilized. It has to be sterilized. Otherwise, you cannot insert into the body, okay? So C. And then 54. Pisiform bone. Pisiform is actually at the base of your wrist on the ulnar side, this bone. Yeah, actually, this bone is a sesamoid bone. It's embedded within tendon. Which tendon? Flexor carpi ulnaris. Flexor carpi ulnaris, which is C. Okay, the C. Greater trochanter. Well, that's probably you know that, right? Greater trochanter is what? The femur. Femur, C, also. And then 56. Cranial nerves that control the pain sensation of the tongue. Remember earlier we have a taste, right? 2/3 in the front, 1/3 in the back. But if it's a pain, 2/3 in the front, not 7, it's 5. Pain is 5. But the back is the same, 1/3. Still what? Glossopharyngeal. So this question, 56, is C. C. Okay? Yeah, so this is different from the taste. You have to remember, okay? C. 57, sexually transmitted infection manifested by painful vesicles. You see those vesicles, fluid filled. And that would be what? Herpes. Herpes is painful. Herpes. Okay. 57 is D. 58, LEPBio10152024. It's a marker particularly for an autoimmune disease. What disease is that? It's D, which is called ankylosing spondylitis. Yeah, AS. Sometimes they go AKS, whatever. Ankylosing means stiffness. Spondylitis is the spine. Yeah, so spine stiffness fused together, okay? Vertebrae. So which is D. D is correct. Yeah, this seems like on the recent national board exam, always test that. So you have to be very quick, respond, okay? 59 was asking, the nuclear imaging scanning. What's example? Well, it's actually PET scan. Positron emission, right? The other one, CT scan, is X-ray, right? Ultrasound is not. MRI is magnetic field, no. So PET scan is a nuclear scan. You have to use a radioactive substance. So 59 is C. 60, transitional cell carcinoma. So transitional epithelial tissue is urinary bladder. So that's the bladder cancer, transitional cell carcinoma, okay? So D, 60. 61, how often tetanus vaccine given adults? Every 10 years. Every 10 years. Yeah, we'll review that later too, microbiology. Viral disease not transmitted through fecal oral. So it's not through digestive. Which one? It's actually measles. Measles through respiratory tract. Mumps, polio, hepatitis A, all go through fecal oral, digestive. Okay? Yeah. Measles is respiratory. B. 63. Genetic disorder, X-linked. Yeah, affect the boys usually, particularly because from the mother. What disease? Actually, all of the above. Hemophilia, color blindness, Duchenne, muscular dystrophy. They're all actually on the mother X chromosome. Given to the baby, right? Because baby get Y chromosome from father, so you never inherit from father, always inherit from mother. So all of the above, same genetic pattern. D. 64. Occurrence of hepatic cirrhosis is what? Well, if you have hepatitis, you have alcohol liver damage, and then you have fatty liver, well, they all possibly can cause what? Hardening of the liver. Yeah, so that's D also. 64 is D. 65. Yeah, skin condition. Very itching, edematous, swelling, pink, red color papules. Plaques, the bigger patches, yeah, superficial layer. So this is what we called is what? Kind of a suddenly very itchy. Yeah, it comes quick, it goes quick. This is allergy. The superficial is what? Urticaria. Urticaria is also called hives. Hives, wheels, TCM we call winged wheels, right? It's like a wing, the migratory sudden onset. So 65 is D. D, okay? 65. And then we have the next one, big 66. Yeah, IBD. We just talked about that, Crohn's disease, right? Crohn's is IBD. Yeah, also with the ulcerative colitis, right? That's just the names. 67. Yeah, you have a nerve entrapment. Nerve got a caught in the hand. Claw hand. Claw hand is which nerve? Ulnar nerve. Yeah, we talk about that, right? Ulnar. Wrist drop is what? Radial nerve, right? Radial nerve. Ulnar, this is A. 68. Mosquito bite transmit what disease? Well, malaria, you know that, right? Scabies is the mites. Lyme is the ticks. Chaga disease is the fly. Tsetse fly, that's what they call. The kissing bugs on your face. Yeah, and then when you're sleeping, right? That's what sometimes they call Chaga disease, sleeping sickness. Yeah. But this is malaria is mosquito. You're not going to miss it. B. 69. Okay, you're talking about this one menopausal, right? 50 years old. And then symptoms, things, yeah. And then when you test it, you find out what level is high. So very likely is what? Is the pituitary hormone level is high. Is LH, FSH. Why? Because estrogen, progesterone level is low and negative feedback, right? So pituitary, FSH, LH is high. But if just separate it, mostly is what? FSH actually. FSH. Because FSH stimulates what? The estrogen release. But when your estrogen is low, right? And the feedback, it becomes high. 8 for 69. 70. ADH, oxytocin, we just talked about that. They are released by posterior pituitary, but they are produced by hypothalamus. So this is release, C. 70 is C. 71, cerebrospinal fluid through the lumbar puncture, right? And in which layer you get a fluid? Well, that's anatomy. It's a subarachnoid space. Subarachnoid. You have those blood vessels, right? And also they drain the fluid. And that's the place you can get a fluid. C. Subarachnoid. C. Okay. 72. All of the following pairs. Yeah, you look at it here, right? Action seems like opposite, except quads, hamstring, yes. Deltoid, serratus, and deltoid is abduction. Serratus anterior is a protraction. No, that's not pair. B is not a pair. B is not. The other one, yes, biceps, triceps, right? Tibialis, gastrocnemius, that's a pair. So this is anatomy. See if you can recognize B. 72 is B, okay? 73. Cannot abduct arm. We just talked about that. Is a deltoid. But which nerve controls deltoid? Also B. Axillary nerve. Axillary nerve controls deltoid muscle. B. 73 is B. 74, middle-aged woman, presenting tired, low-grade fever, unknown cause, painful, swollen joint, butterfly rash. Just based on that, that is what? Lupus, right? It's a lupus. Lupus butterfly rash on the face. Is that right? Yeah, so 74 is lupus. Systemic lupus erythematosus, okay? SLE, okay? 75, yeah, scurvy, we know that. Scurvy is the lack of vitamin C. Vitamin C, right? Yeah, so vitamin C required for collagen fiber formation. If you don't have enough, then what? The collagen fiber is weak, that's why you got a gum bleedings, right? No supporting structure, vitamin C, okay? 76, pathogenic myasthenia gravis. Yeah, we talk about this. This is actually an autoimmune disease. An antibody blocking the acetylcholine receptor, so muscle cannot contract. Supposed neurotransmitter bind to receptor, but then you block it, right? So this is actually what we call what? Anti-acetylcholine receptor antibodies, autoimmune. So this is basically, you have to know the mechanism of this disease, okay? So 76 is D. 77, motor neuron disease. Yeah. Both upper, lower motor neuron affected. That's only one disease. Both affected is ALS, Lou Gehrig's disease, right? Lou Gehrig, amyotrophic lateral sclerosis. Both upper motor neuron from central nervous system and a motor neuron, lower motor neuron from peripheral, all affected. Yeah. So eventually, how patient die? Diaphragm. Yeah. Diaphragm is a motor neuron, right? Control. So they're respiratory failure. So D, 77. 78, Lachman test. Yeah, Lachman test is for what? For ACL. Yeah, just similar to the anterior jaw test. We'll talk about that. It's for ACL, anterior cruciate ligament. Yeah, the test to see any injury, okay? C. 79, a person has infertility with two major symptoms: dysmenorrhea, painful menstruation; dyspareunia, painful sexual intercourse. So those are painful things. Is related with what? Endometriosis. Yeah, that's particularly typical. Endometriosis. Just add another one. Endometriosis is confirmed by laparoscopy, endoscopic examination. Find out there's a uterine lining tissue growing outside the uterus. So that's what it is, okay? And that can affect the what? Because of scar tissue causing what? Infertility. So this is B. 79 is B. 80. Kegel exercise to elevate pelvic floor after childbirth for women, right? And then to strengthen the what? Pelvic floor muscles to prevent a future prolapse of the organs, right? So C, yeah, Kegel is C. Exercise, pelvic floor. 81, yeah, eye disease with the cloudiness of lens. Yeah, that's a cataract. Cataract lens becomes cloudy, right? And when it's mature, you have to replace the lens. So that's 8. 82. Yeah, what therapy for person is expected to be effective? Which therapy? For patient with psoriasis. Well, psoriasis is not infections, right? So antimicrobial is not effective. Steroids, yeah, could be. Yeah, it's very bad. Skin moisturizer, yeah, because it's very dry. And immunosuppressive, yeah, because psoriasis is caused by immune system. So everything's good except what? Antimicrobial, because that's not a bacterial infection. Antimicrobial is microorganisms, right? So B, 81, not expect to be effective, is B. So it's B for 82, okay? B for 82. So this is what we see. Then after that, 83, evaluation and management ENME. They have a coding too for medical billing. And this billing is based on what kind of code? Also what? CPT code. Yeah, it's related. CPT is more for treatment. The E&M codes is more for diagnosis. The diagnostic code. Like what disease, you diagnose, they have a code, okay? So you understand. A, yeah, it's A, okay? We're going to review that too later, okay? Yeah. And then 84, 50-year-old man presenting with a sudden onset, excruciating pain at night, big toe. It's like a gout, is right? A gout patient, when you do the lab test, what do you find? Uric acid, right? Uric acid levels high. Yeah, uric acid, C. 84. 85, acute cholecystitis, gallbladder inflamed. Positive Murphy sign. Where is actually gallbladder? Is the right one, upper quadrant, right upper quadrant. Yeah, so which is 85 is what? Is D. Is D. Actually, this particular Murphy sign we'll review probably next week. Yeah, with particular those names. Yeah, it's D, right upper, right? That tells you the location. Now, restless leg syndrome. What was on the board exam? This person, especially when they are resting at night, feels like uneven, the leg is not comfortable, throbbing, you're pulling, and they really have to get up to do some activities to relieve this. So this is actually what? The answer is also A. When the patient is resting at night, and it suddenly feels like the leg is not comfortable. So restless leg. So the leg cannot rest. That's what it means, okay? We still don't know what the cause, but just the manifestation is that. So answer 86 is also A. 87, injury to which nerve listed below may cause respiratory failure. That's phrenic nerve, right? Phrenic nerve controls diaphragm. That's obvious, right? Yeah, C. 88, cardiovascular respiratory control center. We know that, medulla oblongata, right? The lowest part of the brain stem. So D. 88 is D. 89, Schilling test. Actually, you know what? Schilling tests these days, they never do this anymore. But I don't know why on the national board, sometimes they suddenly have a question. People say, like, what? This is actually a test testing B12 deficiency caused anemia. Remember, we said B12 absorption need an intrinsic factor from the stomach, right? Without this factor, you cannot absorb B12. So Schilling test is what? So if you suspect this person has B12 deficiency caused by this, how would you know? Well, you give them intrinsic factor, and then you test B12, hey, the condition improved. That means it's confirmed. It is the stomach problem affecting the B12 absorption, right? Yeah, so it's called pernicious anemia. Pernicious anemia is a B12 deficiency, vitamin B12 deficiency, okay? But you know what? These days, they don't actually do this test anymore, seems like clinically. But you do see the board question, but you just have to know, okay? So which is B? Yeah, which is B for 89, okay? And 90 is what? CDC. Yeah, and then if you work in an area with lots of drug addicts, AIDS patient, then you have a chance to maybe get a tuberculosis. So every 6 months, you have to have a screening. Every 6 months, you need to be checked to see if you got a TB, tuberculosis, respiratory tract, right? So 90 is B. 91, H. pylori. That's a bacteria, right? Related with the stomach, inflammation, ulceration, and a cancer. Except B, gastroptosis. That's a drooping of what? Of stomach. Stomach is going down. Prolapse, which is not related with the bacteria, right? So B, except the B, gastroptosis, drooping of the stomach. 92, young woman treated with antibiotics, broad spectrum, suddenly what for abortion. And then bloody diarrhea, mucus. Wow, that's antibiotic associated pseudomembranous colitis. Yeah, so what's the name of bacteria? We mentioned that before, right? C. diff, Clostridium difficile, which is C. C. diff. Okay, so 92 is C. C. diff. 93, most common parasitic infection. I think we reviewed that, right? In the U.S. is what? Is Giardia. Giardiasis was contaminated water. So people using the well water, in their backyard, they dip a well in the countryside, likely to get a what? Giardiasis. So that's A. Yeah, that was actually happened on the national board exam. Usually parasitic infection is not very common in this country, but this is the only one. Yeah, possibly, okay? Yeah, A. 94, patient consulting primary physician about his the recent gradual loss of vision, little by vision, And the ocular least likely loss of vision could be cataract, glaucoma, multiple sclerosis, but not for conjunctivitis. Conjunctivitis is the pink eyes. Pink eyes is not going to affect the vision, right? Generally not going to affect the least likely. So this 94 is C. 94 is C. 95. Anybody involved in anaphylactic shock, suddenly you're allergic to something, right? Get a shock. That's E, IgE. E, you can think about what? Emergency, emerging conditions. So B, 95 is B, IgE. Because IgE antibody can attach to the basophils or master cells, right? And they suddenly release lots of what? Allergic agent, like histamine, and then causing what? Anaphylactic shock. So 95 is B, okay? IgE antibody, immunoglobulin E, okay? 96, alpha FP, fetal protein. During pregnancy, fetus have it, but now an adult has this increased level of FP, liver cancer. We talked about this before, right? Alpha FP, AFP, liver cancer. Okay, and then you have different tumor markers. Different ones. And for the other ones. Okay, but we're going to review that too in the lab test. But liver cancer, hepatocellular carcinoma is AFP. Okay, D. 97, calcitonin, which is a hormone, right? In the calcium regulation, particularly when blood calcium is high, it switches the calcium all the way to the bones. But this hormone is secreted by what? By the thyroid gland. The thyroid. But don't forget, there's another hormone balanced out with this one. It's called PTH. PTH is a parathyroid hormone. That is secreted by parathyroid gland. Is when the blood calcium is low, PTH release, try to mobilize the calcium from the bone, from intestine absorb, from kidney reabsorption, increase blood calcium. But when the blood calcium is high, calcitonin from thyroid, and it push calcium to the bones for deposit. Okay, so 97, the answer is B, thyroid gland. I tell you, this is almost 100% sure. Recent years, every time it's a question on the national board exam. So it's kind of, but you really have to know it. Okay, so B. 98, normal cardiac pacemaker. So which structure controls your overall the cardiac rhythm? Well, that means what? It's SA node, right? We know that sino-atrial node, sino-atrial, which is also called what? SA node, right? SA node. That's a pacemaker, right? Pacemaker. But where is it located? Location is a right atrium, right side of atrium. You know what? Right atrium, very interesting. Pretty much everything for the heart, starting point is from right atrium. Why? Right atrium pacemaker initiate a signal, spread down, right, to control the cardiac muscle contraction. Right atrium also has superior vena cava, inferior vena cava, all the blood return, right? And even from a cardiac circulation, coronary circulation, you have what they call coronary sinus. The blood also return to right atrium. So right atrium is the first one that collects the blood on the right atrium. And also right atrium secretes a hormone, which is called what? Atrial natriuretic peptide, AMP. And this hormone is against aldosterone. Why against aldosterone? Well, aldosterone too much, retain sodium, remove potassium, retain water. So you have lots of blood volume, right? So when you have more blood volume, when the blood flowing to the heart, to the right atrium detected, wow, how come I have lots of blood? Blood pressure is very high. So then the right atrium cells will start to release what? ANF. And ANF what? Against aldosterone. So lower the blood volume, lower the blood pressure. Okay, so B. 98 is B. 99, a surge in which hormone required for ovulation? Right before you ovulate, the eggs mature in the follicle, you need to have a sudden increase, surge, luteinizing hormone, LH, from pituitary gland. Then the egg can be released. So a lot of people cannot release the egg because lack of the surge. So C is correct. C is correct, luteinizing hormone from pituitary gland, okay? You need to have a surge. Last one. Following an ileo resection, ileo is ileum, last part of a small intestine. Which of following vitamins absorption is affected? Well, obviously, ileum only absorbs vitamin B12. So B12 absorption requires two things. One is intrinsic factor from the stomach. Second is you have to have a site, which is ileum. So intrinsic factor is missing, or ileum surgical remove, resection is removed. Why? Maybe they have a disease like IBD, Crohn's disease, right? You remove this part of intestine, so B12 absorption will be affected. And B12 deficiency, don't have enough B12, and you get a what? Pernicious anemia. Pernicious. Okay, so it's recorded, and also I'm gonna post the answer keys right after this. So if you miss some questions, you can double check the questions to see which one you missed. Actually, quite a lot of those questions from previous national board exam. I can tell you, yeah. So you basically need to understand every single question. What do they ask you? So you have to understand that. Okay. So until next week, and then we will continue our review. Okay. Thank you.